This video explains the reasons why hand expression is useful for mothers. Include situations where the baby struggles to attach, when the mother experiences issues such as a blocked duct or mastitis, or simply when some mothers prefer hand expression. During hand expression, we demonstrate a specific technique. We always encourage mothers to begin with massage, as it stimulates all the nerve endings in the breast tissue. Perform actions such as kneading and tapping for just a few minutes. Once that's done, we instruct you to create a C shape with your finger and thumb, targeting the area central to the nipple, approximately 2.5 centimeters back. You'll notice a change in the texture of the breast tissue, becoming somewhat lumpy. Apply a compression movement, establishing a rhythmic pattern. By doing this, you should observe a small glisten of colostrum at the end. Feel free to change positions, considering the breast to be like a pizza, with milk ducts in each slice. Experiment with different directions for a more effective hand expression experience.